So this is my wound culture video. So the first thing you always want to do is, of course, check the provider's orders. Once you're done with that, so when you check the provider's orders, you're checking to make sure how many cultures or how many specimens you do need and when you need to perform them. After that, you'll walk into the patient's room, introduce yourself, and then explain why you're there. So my name is Ari, I'll be your nurse today. I'm here to perform a wound culture. You always want to check two patient identifiers, so you'll ask the patient name and date of birth.
Travis 121188.
And then you're also checking his wristband to make sure that it matches up. From there, you want to go ahead and perform your hand hygiene, and you're going to go ahead and put on some clean gloves. So when you first come in to do a wound culture, you just want to inspect to make sure that there's no signs of infection. So you're checking for fevers, chills, excessive thirst, things like that. So the patient doesn't have any of that, so that's really good. Next, you want to go ahead and assess the bandage. So you're going to remove the Band-Aid. So his wound is on his arm. So you're removing the Band-Aid, and when you do, you're checking for any drainage or exudate, like anything like that. And then you'll go ahead and just fold that bandage up and place it in the correct reciprocal. And then you will go ahead and actually remove your gloves. So these are now dirty. You're going to want to clean around his wound area next. But first you want to go ahead and just assess it once you put on your sterile gloves for any inflammation, any swelling, drainage, any redness, or anywhere that the wound has separated. So you're putting on your sterile gloves this time. Mine are a bit messed up from the last video. And you're also going to want to rate the patient's pain of the wound as well, because you want to document that. So you would ask Travis, on a scale of 1 to 10, how bad is the pain of your wound?
6.
A 6. Okay, so it's a fresh wound. It's going to have some pain with it. So again, you're checking his wound for that swelling, inflammation, drainage, signs of infection. You want to go ahead and clean around his wound. So you're taking an antiseptic swab, and you're just going to go ahead and clean around his wound, looking for any of the exudate, and then you're going to go ahead and dispose of this. So you'll dispose of it. From here, you're going to remove your sterile gloves, and then you're going to open up your culture tube, and then you'll put on a new pair of sterile gloves. Of course, I don't have a new pair, so but you would perform hand hygiene, and then you'd put on your new pair of sterile gloves. From here, you're going to perform the culture. So you would go ahead and take your culture swab, and you would place it into the part with the freshest drainage, and you're going to do it gently, and while you do that, you're going to go ahead and just rotate the culture swab. So you would place it in, rotate it around, and then you would go ahead and put it back into the tubing. If you were doing an anaerobic bacteria aspiration test, you would use that needleless syringe, and you would go ahead and place it in and aspirate it 5 to 10 milliliters. You would then put the transfer device in, expel the air, and then you would put that you would push the bacteria into the tubing. But I don't have that, so we're not going to do that type of culture today. So from here, you went ahead and you have your tubing. You're going to want to go ahead and document your tubing and verify all that information in front of your patient. So if the patient was also on antibiotics, you would want to note that on this as well. Then you want to go ahead and put it in a biohazardous bag. Once you're done with that, you can go ahead and remove your sterile gloves. And you would perform hand washing, and then you would check to see if the provider actually ordered you to clean the wound. If you did, you would go ahead and clean that off. Of course, you'd put new gloves on before you did so. So you put new gloves on, clean his wound, and then you would bandage it with more sterile bandages. And then after that, you would go ahead and remove your gloves, well, you would actually throw away all of your supplies, remove your gloves, and then you would perform hand washing again. If the patient did need your help to get into a more comfortable position, you would go ahead and perform hand washing again, put your gloves on, and then help them to move. And then from there, you would go ahead and send the culture into the lab. And if you were going to follow up on this patient, you would need to, the next time you came around to do your round, you'd go ahead and check those labs to see what the results were.